My name is Wan Zaid Zafar binti Sharum and I will present Thesis review patient access to medical record in Malaysia. For the background of the study, medical records are an important source of hard information that help patients understand their medical condition and treatments. In today's healthcare environment, electronic medical record and electronic health records are widely used to improve healthcare services. At the same time, healthcare is increasingly moving towards a patient-centered approach where patients actively participate in healthcare decisions. However, Malaysia still lacks specific legislation that grants patients a clear right to access their medical records. This raises concern regarding patient autonomy, transparency and access to healthcare information. Therefore, patient access to medical records has become an important issue in Malaysia's healthcare system. There are three problem statements in this thesis, which is the first one is lack of clear legal recognition of patient access right, which is there's no specific law grant patients to access their medical records. Access often depends on court order and inconsistent implementation patient autonomy and access. The second one is ethical conflict between patient autonomy and medical paternalism. Medical paternalism still influence healthcare practices. Information shared within patient remains limited. Conflict exists between patient autonomy and concern about potential harm. And lastly is wider patient access is not fully recognized in current healthcare practices. Then the third one is regulatory and implementation challenges affecting wider access, which is existing regulations do not provide comprehensive guidance and healthcare organizations face difficulties implementing consistent access policies. There are three research objectives, which is the first one to examine the legal impediments to enabling wider patient access to medical records in Malaysia and compare them with the UK. The second one is to examine ethical theories and applications that can be used to justify the need to wider patient access to information medical records and application. And the third one is to identify the legal and regulatory changes required to support the objective of granting wider access to medical records to patients. There are three research questions in this thesis, which is first, what are the legal impediments to enabling wider access to medical records for patients in Malaysia and how does this compare to the UK? Second, what ethical theories and applications can be used to justify the need to widen patient access to information in medical records and application? The third one is what are the legal and regulatory changes required to support the objective of granting wider access to medical records to patients. For operational definition, the first one is medical record, which is record containing information about a patient's health and healthcare treatment. Second, patient access, which is patient has the ability to access and use the information in medical records. Third, patient autonomy, the patient's right to make informed decisions regarding healthcare. Then medical paternalism, healthcare decisions made by professionals on behalf of patients for preserved benefits. Then regulatory framework, laws, policy, guidelines and institutions governing patient access to medical records. And lastly, patient advocacy, action that promote patients' rights and participations in healthcare. For the scope of the thesis, is to develop a practical framework for wider patient access to medical records. The study provides recommendations based on the legal and ethical considerations, examine the Malaysian legal and regulatory framework, compare it with the United Kingdom, and identify possible improvement to support the patient access. There are several limitations in the study, which is the first one is there is limited empirical data regarding patient access requests and refusal in Malaysia. Second, it is difficult to measure the actual scale of the problem because of the lack of available statistics. Third, the study relies mainly on secondary sources such as legislation, case law, guidelines and journal articles. And finally, there is limited previous literature discussing patient access rights in Malaysia. For conceptual framework and research design, the study used a qualitative doctrinal research design. It analyzed legislation, regulation, case law, professional guidelines and academic literature. The study also compares Malaysia's legal framework with the UK's framework. In addition, ethical analysis is conducted using utilitarianism, deontology and principalism, while regulatory analysis examines stakeholder roles and healthcare governance. This approach helped the author develop recommendations for improving patient access. Research significance and contributions. It addressed about limited patient access to medical records and set the gap in legal and regulatory aspect, applies the principalism ethical framework to justify wider patient access. Moreover, the thesis also contributes in healthcare reform, patient empowerment, patient-centered care practice development. For literature review, the literature review highlights several important concepts, which is patient access to medical record is important for transparency, patient-centered care, and shared decision-making. It's also about patient autonomy, emphasize a patient's right to make informed healthcare decisions. However, medical paternalism may limit access because healthcare professionals sometimes make decisions on behalf of the patients. The study also discussed ethical perspective, which is utilitarianism support access because it benefits patients. Deontology support access because patients have a right to information about themselves. Principalism balance autonomy, beneficency, non-maleficency, and justice. And the review further highlights the importance of trust communication in the doctor-patient relationship, as well as the role of multiple stakeholders in regulating access to medical records. The methodology of the thesis is doctrinal research, which is data are collected by analysis document about legislations, regulations, case law, guidelines, and academic literature. Second, ethical analysis, which is it use principalism framework to evaluate patient access to medical records. Third, regulatory analysis, which is examining the regulatory space in Malaysia, including the role of stakeholders, healthcare hierarchy, medical paternalism, and the need for both state and non-state reforms. The last one is comparative legal analysis, where the author compare the Malaysia and the UK. For the result data analysis, the findings are divided into three areas, which is the first one, Malaysia does not have a specific law granting patient access to medical records, unlike the United Kingdom, which provide a clear legal rights. Second, wider patient access is ethically justified through utilitarianism, deontology, and principalism. Third, legal reform alone is not enough. Challenges such as medical paternalism, hierarchical doctor-patient relationship, and limited patient involvement continue to affect access practices. The study recommends legal right of access, dual ownership of record, stronger regulations, patient advocacy, improve the electronic health record system, and better doctor-patient collaboration. Further discussion, Malaysia currently lacks clear legislation on patient access to medical record, resulting in more limited access compared to the United Kingdom. Wider access is ethically supported by utilitarianism, deontology, and principalism, particularly in promoting patient autonomy and involvement in healthcare decisions. However, legal reform alone is insufficient, as medical paternalism and limited patient participation continue to affect access practices. Therefore, both legal and non-legal reforms are needed to improve transparency, collaborations, and patient empowerment. The author proposed several recommendations, which is the first one, Malaysians should establish a clear legal right for patients to access medical records. Second, a more integrated regulatory framework should be developed between public and private healthcare sectors. Third, medical records should adopt a dual ownership approach, where healthcare provider own the records while patients have right over the information. The study also recommends strengthening fiduciary duties between doctors and patients, improving electronic health record system, enhancing patient advocacy programs, and promoting stronger doctor-patient collaborations. These recommendations aim to improve transparency, trust, and patient participations in healthcare. In conclusion, Malaysia should expand patient access to medical records. While legal reforms are important, regulatory improvement, stronger patient advocacy, better electronic health system, and improved doctor-patient collaborations are also necessary to support a patient-centered healthcare system.